COVID-19 has gripped the nation and the entire world in a matter of a few months, and it's not letting go. Borders, politics, economic status have proven to be not significant barrier or deterrent.
But it has hit Black and brown America in an even more insidious way. According to AARP statistics, in fact, 33% of Black Americans 65 years of age or older have at least one negative contributing health factor, as opposed to 51% of white adults in that same age group.
And Black people are the least able to withstand the fluctuations of the American economy because we're usually the workers who were last hired and first fired. Now joining us is Representative Gilda Cobb-Hunter of South Carolina, who's also president of the National Black Caucus of State Legislators. Welcome to the program.
Thank you for having me.
Can you tell us what are the risks for a premature opening of your state and others, not only to the general population, but to workers?
Well, and let me say the National Black Caucus of State Legislators represents over 700 Black legislators across the country. And here in South Carolina, as well as across the country, my colleagues are concerned about a premature opening for several reasons. One, it's a known fact that we are disproportionately affected. We are usually, as you pointed out, the last hired, first fired, and the inequities that are apparent in communities of color, the disparities make it very difficult. The whole premise that it is easy to reopen and open businesses back up is based on the idea that we have income levels of income equality, and we don't have that. And so at NBCSL, we recognize that when we talk about who the barriers, who the burdens will fall on, we're talking about Black and brown people. The industries that are being reopened are service industries. People who work in these industries are usually low-wage workers. And the final point I would make on that is it's important for policymakers to connect the dots. It's important for us to understand that it's not just about health inequality and health disparities, but we've got a bunch of other factors, social determinants that factor into this as well.
And also South Carolina, beautiful state that it is that you have there, is a recreational state, beaches, golf courses, all those kinds of things. What kind of a financial hit are you taking in those areas right now?
South Carolina, where you are there in Florida, and most states along both coasts, is seeing a real significant economic impact from a negative standpoint. Tourism is the lifeblood of South Carolina, as it is of many states in the Southeast. And we acknowledge that there is an economic impact of being closed. The question has to be asked, though, is it important to have businesses reopen at this point where it is not safe? Because the reality, Fred, is that there is not a strong testing program in place in most of these states. There is not a strong testing program in place in most of these states. And so when we talk about reopening, our concern is that we are being penny wise and pound foolish. All of the public health officials are saying that there is likely to be a second wave in the fall. So what happens if we reopen now with no idea of the prevalence of this virus and then have to come back in the fall and close businesses again? That double whammy for low-wage workers is more than they ought to be asked to sustain.
Are you going so far as to tell people in our community, even though places are reopened, to simply not participate?
I'm not going so far as to say anything to anyone other than this virus is serious. This is a decision that each individual will have to make. But what we are saying at NBCSL is that there are a number of factors that ought to be taken into account. The realities of struggling families, if we talk about social or physical distancing, staying in place, a lot of people don't even have a home to be physically distant in. There are so many other social determinants. We recognize that people need their jobs. What we think is important is that in this crisis is opportunity. And what we as a nation should do is use this opportunity to come up with systemic changes that will improve the economic well-being of all folk, because there will be another virus. This one is new, it's unknown. Another reason we shouldn't be rushing into reopening. There are just too many unknowns about the treatment, the testing, the transmission. And again, the final point is this is an individual decision that people will have to make for themselves. We recognize it's a tough choice, but at some point we've got to decide, is it more important to bring back the economy, or is it more important that people's lives be saved and not put in jeopardy? We believe we ought to reopen, but it ought to be done in a very safe way when testing and contact tracing is in place. And quite frankly, that is not in place in most of these states, South Carolina included.
And Representative, I'd be remiss in letting you go without asking you about one of your great HBCUs there, South Carolina State University, and how it's being affected by all of this COVID-19, and the student body there and the faculty as well.
Well, I thought since you were in Tallahassee, you were about to ask me about the Florida A&M University, which is my alma mater. But South Carolina State, like most colleges across HBCU and PWIs, are affected. They are affected by this virus. They have closed down, and the financial hit that colleges and universities are experiencing as a result of this hit is something that has to be taken into account as well. At the federal level, there is recognition that colleges are losing money. And when we talk about South Carolina State University, we really have to recognize that SC State was already experiencing some fiscal difficulties. They were back on the right track and moving forward under the leadership of President James Clark. And so they really didn't need this virus. And quite frankly, nobody did. But it has affected South Carolina State just as it has affected a lot, most other universities in the country.
And please forgive me for disrespecting the rattle. Thank you very
Rattlers. It's okay. We caught it in time. Don't worry about it.
All right, Representative Gilda Cobb-Hunter, thank you so much for your time this Friday evening.
Thank you for having me.
Please be safe.